Using Anki alongside the AMBOSS practice questions is something that I did that I feel like was absolutely crucial to me performing well on step 1 and step 2. And this is because you want to learn the material and really reinforce it with the practice questions, but then you want to be able to go to Anki and never forget that. So this is a great example practice question here. And one of the things I love about the AMBOSS practice questions is that you can click on this and actually see what should I be focusing on in this. And if you're still a little bit stumped, then you can do the attending tip to pull this up and kind of lead you in the right direction. So as we're learning this question, we're reading this as something where there's a young 5-year-old boy, they've got a broad-based gait, they've got swelling of the optic discs, there's something going on with their eye, there's a tumor from primitive neuroectodermal tissue. So we could start thinking about this, and if we think, hey, maybe it's a pituitary adenoma. Oh, no, it's not because of this reason, but it's not going to tell me the answer yet, so I can still keep guessing and working through this until we get to the point where it's, oh yeah, that's right, this is a medulloblastoma. And now this is the point, because I missed this topic, I'm going to go and make an Anki flashcard on this to help me remember. So I'm going to go over to Anki, which I just keep open side by side, or you can use 2 screens. And I'm going to add a flashcard. We'll choose the note type that we want here. And then I'm going to put some text in here of the key point that I want to remember. Well, I think this is a great point that I should remember from this practice question. A medulloblastoma is the most common malignant brain tumor in children. So I'm going to select that text and copy it. We'll come over here to Anki and paste it, and I'm going to make that into a closed deletion and format the card. So I will take this here, and we're going to turn it into a closed deletion. So it's essentially a fill in the blank. And then I want to do most common malignant, and I will underline that, and then we'll do in children and bold it just so it's a little bit there. Now, in the extra section, I usually like to add something that gives me a little more of the big picture. And one of the things that's fantastic that AMBOSS has that you can add into your Anki flashcards are these pictures. I love the way that you have these pictures and they have the overlay so you can actually see the key elements here. So I'm going to do that, and I'm just going to use my computer's screenshot function. We'll screenshot this. Actually, we might as well take all the text as well. And I'm going to put that into the extra section of the card here to help me remember that. Now you could also type other things into the extra section if you wanted. If you wanted to type this piece here, this tumor is derived from primitive neuroectodermal tissue, you could do that. Actually, I would recommend probably just making a separate card entirely based off of that fact as well. Go ahead and add a tag here, for your missed questions or whatever it may be, and then add the flashcard. And I usually do this for all the flashcards that I miss, all the practice questions where I'm missing a concept. I'll go make an Anki flashcard for that so that I never ever miss that topic again, and that'll help your performance improve significantly.